as nonpartisan fashion as I possibly could, begging Democrats to pay people that are forced to work, that are keeping our skies safe, that are keeping our nation safe. 2 weeks later, we haven't done it. This isn't partisan. Search your conscience. Ask yourself, honest to God, if a plane has fallen out of the sky. I'm not saying it's because of air traffic control, but you've heard 500 safety instances. Our air traffic control system is already antiquated. Can you live with yourself if another plane falls out of the sky and more people needlessly die because we're short of air traffic controllers? I know Senator from Alaska has a couple more comments, then we'll turn it over to the Senator from Florida.
Well, I just want to thank Senator Cruz, Senator Johnson, for coming to the floor and making this very strong case. And it's about safety, and it's about the American way. There's nothing more American than paying people for the work that they do. We all know that. Again, Senator Johnson's bill is a simple bill. It's about paying the federal workers who are required to work to keep us safe. All these jobs we're talking about are jobs that keep the American people safe. Of course, the military is a big part of this bill. They epitomize the federal workers who are keeping us safe. And they epitomize courage. So do many of our federal workers as well. So I hope my colleagues on the other side of the aisle just show a little bit of the courage that our military displays every day all over the world. Just a tiny bit of that courage. Again, to my Democratic colleagues, we know you're getting a lot of pressure from your leadership. Senator Cruz did a great job of explaining the origins of that. By the way, it has nothing to do with health care, it has nothing to do with anything. It has everything to do with appeasing the far left of the Democratic Party, which is rising. So we get that you're under pressure. But you all know that voting for this bill is the right thing to do. I know my colleagues on the other side of the aisle. They're good people. As Senator Johnson just said, have a little bit of conscience and a little bit of courage, the kind of courage that our military displays every day, and vote for the Shutdown Fairness Act right now. Every one of you knows it's the right thing to do, and I hope you do it.
Thank you, Senator from Alaska. Yield now to the Senator from Florida.
The Senator from Florida.
So, Mr. President, first thing I want to do, I want to thank all the senators that are speaking tonight. I can't imagine voting not to pay somebody. You know, in my state, here's what's happening. We have people that are not getting food. At church on Sunday, the pastor asked if we would actually bring in a whole bunch of food because they knew because of what the Democrats were doing, people would not get their food stamps. So all the food banks, they needed way more food. I was talking to a reporter today in Tampa, and he said the line is unbelievable at one of the food banks he was at in Tampa today. And when I think about these people that are not getting their food stamps, I think of my mom. So my mom was a mom of 5 kids. So we lived in public housing. I never met my dad, and she had to go to farm to market stores and ask for food. She never got food stamps, but she had to go ask for food. So just think about what's going on around our country. There's people right now worrying about if they're going to feed a 2-year-old little kid. Can you just imagine what that mom's doing? I mean, I just can't imagine how anybody ever could vote to shut down the food stamp program to not feed kids. Then let's think about all these people not getting paid. So I'll give you my experience. When I was 19 years old, I got married. I was an E2 in the Navy. and I was making $334 a month. So that same person today, and my wife and I, she was making $75 a week as legal secretary. So those people, if something like that, I didn't have $25 in the bank. They wouldn't have said, oh, it's okay not to pay the rent. Any costs we had, no one would have said, oh, don't worry, you don't have to pay it now. And so that's what's going on with our military. They have mortgages, their kids have school costs, their kids want to play sports, they might have medical bills. And my Democrat colleagues are saying they don't care. It's just did they ever live that life? Did they ever live the life that they are worrying paycheck to paycheck how they're going to pay for food, for the rent, for a mortgage? Do you think all the lenders are going to say, oh yeah, we know the government shut down, so you don't have to pay your mortgage? So I just don't know how you could not have a heart to open up government. I mean, we can have a policy disagreement every day, and we should. But to not make sure people get their food stamps, not make sure that people are showing up today, as Senator Cruz said, trying to keep us safe in the skies, our military that's trying to keep our freedoms, and the Democrats don't care if they get paid or not. Now let's think about it. Since I got up here, I've been at this my 7th year, I've had a bill that says no budget, no pay. Right? The Democrats have blocked it, including yesterday, because they want to get paid, even though they are making the decision that other people don't get a paycheck. They're not willing to give up any of their pay because, like one of them said, he has a mortgage. Why would he be expected to give up his pay? Well, they're doing it every day to all of our federal workers. I just can't imagine doing that. So what I'd say to my Democrat colleagues, open the government. Pay our workers. Make sure people get food, have food on the table. Don't ever, ever, ever in your wildest dreams do that to people in our country. It's wrong to do what you're doing. Senator Schumer came out and said he had a proposal. It's a joke. It's a complete joke. And I'll tell you why. Let's think about what they want to do. For us to be able to make sure that we start paying people, they get food stamps, they want to make sure insurance companies continue to get rich. So their proposal doesn't do anything. So right now, people don't lose their Obamacare subsidies. It's people that make over 400%, that's over probably $128,000, $130,000 a year, get subsidies for their health care. You could be a millionaire. You get a subsidy. So he wants to make sure millionaires get a subsidy for people to possibly get any food. Then he knows that Republicans are not going to continue to support a program that pays health care for illegals. That's wrong. Has taxpayer paying for abortion. That's wrong. Has taxpayers paying for trans surgery. That's wrong. Making sure there's about supposedly 4 to 5 million people don't even know they have these subsidies, because it's just going directly to an insurance company with no responsibility by a consumer. All you have to do to sign somebody up is know their name, their birth date, their address, sign them up, insurance companies get all the money. Why would we ever support something like that? So I want to thank my colleagues. I can't imagine. It's heartless to not make sure people have food. It's heartless to make sure people don't have money if they're working. And so if the Democrats vote against Senator Johnson's simple bill to pay people that are busting their butt to keep our freedoms, keep us safe, do all these things, I don't know how you can go home and feel good about what you're doing. I yield my time.
I want to thank the senator from Florida. I see the senator from Michigan. I believe he wants to speak to this bill. We will have the last word, but if he wants to get ready, I don't know.
Let the chair. I'll recognize the senator from Michigan, and then we can go back to the senator from Nebraska.
Thank you, Mr. President. Well, let me first say that there's something that we all agree on, Democrats and Republicans here in this chamber, is that we want federal employees to be paid. It's simply unacceptable that they have to work and come to work every day, do their job, and not get paid. That's why we got to end the shutdown as quickly as possible. We're focused on doing that. But that's not really exactly the total story behind the Johnson bill. I have legislation to pay federal employees now. We could vote on that now. I offered it in a UC request from my colleague from Wisconsin and said, we have a bill to pay all federal employees right now. No strings attached and no language that gives the president more power, more flexibility to do things that we should not want him to do. But my Republican colleagues don't want to have that bill. Senator Van Hollen, another colleague of mine, has a bill to pay it. It has complete support of Democrats. Let's pay them. We have two bills that if we put on the floor right now, we can pass. If my Republican friends really want to do it, we can pass it with 100 votes. And I'm happy to, it's my bill, but any of you can sign it. I offered it to my colleague from Wisconsin. It could be your bill. Give it. I don't need any authorship of it, but it's a bill that does exactly what my colleagues across the aisle are saying, just pay federal employees. That's what it would do, and yet that's rejected. So why? Well, there's a little bit more in this bill. In fact, the Johnson bill before us actually creates an unlimited and permanent slush fund for President Trump to use. You're not going to get support here from us to transfer what should be congressional power to be able to determine when we want money spent, it actually gets spent the way it should be. It's not about passing a slush fund to the president. The president could justify the transfer of this money elsewhere. This is something clearly the administration wants because it's going to give the White House more power. The bill adds presidential authority by it omits the regular safeguards that we include in normal funding bills to ensure that money actually goes where Congress intends. Now, we've been seeing a lot of that. The president basically is just thumbing his nose at Congress every day. Unfortunately, my Republican colleagues say, well, that's okay. If the president doesn't want to listen to the Congress, that's okay with them. And we are a co-equal branch of government. We're elected by the people back home to represent our people as senators. We're not here just to rubber stamp a president. I know a lot of my colleagues on the Republican side of the aisle, I'm surprised because a lot of really great people that I have a lot of respect for, and yet we see the president constantly run over Congress, and it's crickets on the other side. No pushback from my Republican colleagues, either here in the Senate or in the House. There's actually, in this bill, there's no explicit guarantee or requirement to actually pay out this money. The administration could sit on this appropriation. We're just plain check appropriation for employees, but the administration could just sit on it for some, or those particular programs they don't like. That's why in a normal appropriations bill, we put in language to prevent that. Now, granted, the president has been ignoring Congress, but at least we put it, we say these are the rules. Congress has the power of the purse. It's Article 1 of the Constitution. And yet a lot of my colleagues don't seem to take that to heart. So most of Trump's bills, including the current House continuing resolution proposal, actually includes restrictions on how funding should be used. The Johnson bill includes no restrictions. And we know that Trump has shown that he will abuse the budget process in very novel ways. He has said that he will refuse to pay back pay to workers even when Congress has explicitly said it. This bill hopefully does address that. He's transferred money illegally to pay for his political priorities, and he impounds money whenever he finds any kind of wiggle room to do that. So in a sense, this bill is a Trojan horse. It's there to say we're going to help federal employees, but it's really continued power for the president. I've heard my colleagues say that the federal employees are being used as pawns. That's what this bill does. It's using federal employees as pawns to give the OMB and the president a whole lot more power to use a slush fund of money in any way he chooses. We know the OMB director, Russ Vogt, likes this bill. We know what Russ Vogt's about. In fact, I think there was a leaked speech that Russ Vogt had. We mentioned this in the committee, and my colleagues, I appreciate them saying how wonderful federal workers are. But this is what the OMB director, who says this is really a good bill, the Johnson bill is a really good bill. He said, we want the quote, we want the bureaucrats to be trauma. They have to be affected by trauma. When they wake up in the morning, we want them to not want to go to work because they are increasingly viewed as the villains. We want to put them in trauma. I hope my Republican colleagues called out Mr. Vogt when he said that, because you care so much about our employees. I appreciate that. But when folks in the administration say things like this, please say that is wrong, that we really do care about you. Not when you're trying to put a bill forward that's going to give the president an unlimited slush fund. Let's be real. If you want to pay employees, which I hope you do, if you want to move forward, then take a bill that we know has the kind of guardrails that our appropriation bills normally do to make sure the money is actually spent as we intend in Congress, which is the way it's supposed to work under Article 1 of the Constitution. I still believe in the Constitution. I still believe that we are a co-equal branch of government. We are not simply a rubber stamp for the president. And if we don't change that way, that's how you lose the checks and balances that our founders cared so deeply about. You know, as our founders were debating the Constitution, they didn't trust any of us. They knew, they're politicians too. They knew you can't trust anybody. So they figure we're going to have three branches. We're going to have the judiciary check the Congress and the president. The Congress will check the presidential power. And Article 1 is the Congress. They thought the Congress was the most important one. But they kind of assumed that the Congress would actually exercise its power and check presidential power. Not just hand more to them with a smile and then use some false pretext in order to give that money. So that's what this bill is about. And you know, I've tried to work with Senator Johnson. I will always want to work with him. We've worked on a number of bills together. We have language. Again, the bills that we have that I've introduced, which is the Military and Federal Employees Protection Act, straight, clean bill. Talk about union support. Every union has supported my legislation. Every union has supported Senator Van Hollen's. And we're now getting unions. Unions are starting to read the fine print on this bill right now. So we have AFSCME that's now come out against it. We got the SEIU that has just come out against it. We have the AFL-CIO that has just come out against it. We have the IFPTE that just coming out. And I guess our union friends are going to read the language of this bill and they're going to like, oh, we should have read the fine print. Like, yes, it's really important to read the fine print. So we can't support this bill. We can support a bill that pays all of our employees, but it's got to be one that has the types of protections that we have in every other appropriations bill that we try to pass out of this body. So I'm going to oppose this, but hopefully we can find a way to work together. We have two bills ready to go we can pass today, but with this bill, we are going to object to this one. Thank you.
Mr. President. Mr. President.
Is the senator from Wisconsin?
Thank you, Mr. President. I'm not quite sure what planet the senator from Michigan comes from, but here in planet Earth, when you read the actual language of the bill, none of these standard provisions exist in there. But I will go through those point by point before we call for the final vote. Right now, I think Senator from Nebraska has a few points he wants to make.
Senator from Nebraska.
Right, thank you, Mr. President. Earlier today, we heard about an offer from the Minority Leader. It shows just how unserious he and the Democrats are. That offer is full of horse hockey. It has things in it that Republicans cannot accept, and he knows it. And my colleague from Michigan, Democrat from Michigan, was just talking about power, because this is what it's about. He mentioned power. A number of other folks have talked about leverage. They need to have this shutdown for leverage. A number of Democrats have said this. But what I'm here today is to talk about people, not leverage, not power, people, air traffic controllers. These are letters that I have received from air traffic controllers. handwritten letters that are talking about what they are going through right now because of the minority leader's shutdown. Let me just read you some of these. My wife suffers from a chronic autoimmune disease that without her medication would cripple her. Our monthly copay for her specialty medication is $2,800 a month. We have less than 2 weeks before her next round of medication is due. Our situation is not sustainable, even with pulling money from our savings. That from one of our aircraft controllers in Nebraska. Here's another one. Each shutdown gets harder than the last. The mental stress of the unknown gets harder each time. With my growing family and medical bills for my family, it gets harder every time. Both my children have neurological disorders that require constant monitoring and medical care. I take pride in my job and the service we provide here at Omaha Approach Control. As a patriot and a veteran, I take my federal oath seriously. I will always continue to do my job and keep the skies safe and expeditious. Or here's another one. Myself and my family, to include my 3-year-old daughter, are struggling to make ends meet. I now have to decide between putting food on the table, paying my mortgage, paying my car note, and many other things I need to survive. Are the Democrats deaf? Do they not hear from the people that are putting in these situations? This is their shutdown. This is their Biden budget they're not voting for. They voted for this 4 times in the last 19 months, and now they won't because their far left wing tells them not to. We have patriots here who are suffering. Why don't they show some of the courage that these people are and stand up to the far left wing and vote for this bill so that at least the people who are working can get paid? Is that so much to ask? That we pay the people who are actually trying to keep the skies safe? The Democrat staffer was earlier quoted as saying, we're going to do this till planes start falling from the sky. Well, folks, we already heard that the FAA is going to cut back 10% this week on the number of flights because of safety concerns. But it's the people that are the air traffic controllers and our law enforcement and everybody else who is working in a federal job that is not getting paid are paying the price for the minority leader shutdown. Thank you, Mr. President. I yield to my colleague from Wisconsin.
Senator from Wisconsin.
And I appreciate the comments from Senator from Nebraska. I think the Senator from Utah would also like to speak to the bill.
Mr. President, I want to commend my friend and colleague, the senator from Wisconsin, for his outstanding work on this bill, the Shutdown Fairness Act. Senator Johnson has seized on something very important here. We're surrounded by people in this very building and throughout the United States and across the globe, people who are faithfully, valiantly working for the United States government. Now, some of them are staffers in this very room, not being paid. Some of them are the police officers we greeted on our way in who are keeping the Capitol Hill complex safe. Some of them are soldiers, sailors, airmen, Marine, guardsmen all over the world who are serving the United States government at risk of life and limb to keep us safe. And there are countless others in different occupations who are not being paid. Why? Well, they're not being paid because our friends on the other side of the aisle are wanting to expand government yet again. They may think that this is the right message, that this is a winning message. This is not. It's not the right message, not a winning message, even for them, because it highlights something. It highlights the danger in putting too much trust, too many responsibilities, too many functions in the United States government. So much so that when a crisis like this emerges, and the Schumer shutdown now drags well into its second month, they see that what the American people have previously regarded as a service performed by their government to them is now being held over them to extort even more money out of them under threat of planes falling from the sky. And we're told by Democrat after Democrat on television interviews and elsewhere, well, it's okay. It's okay because this is leverage. This is our leverage. Well, what do they want to use that leverage for? They want to use it so as to paper over the failures, the abject failures of Obamacare, this law that has succeeded in doing exactly one thing: enriching large health insurance companies while making all Americans poorer. Premiums have skyrocketed, coverage has diminished, quality has completely tanked as a result. They know this, they understand this, they see premiums continuing to increase year after year after year. And so what do they want to do with it? Well, they want to spend a lot more money moving forward. Money at a time when the US government is already $38 trillion in debt. Money to hide, to conceal what it is that Obamacare is doing to the American people. When in fact, what Obamacare has done is diminished the healthcare options that the American people have. It used to be that you could negotiate with a health insurance company and buy a health insurance policy. But Obamacare in many ways made what was once health insurance illegal. We need to make health insurance legal again. We need to allow a willing customer to pay a willing insurer for a health insurance policy, rather than an Obamacare health plan, which very often, through its Byzantine labyrinth of federal regulations, just adds to the cost and adds to the profits, the bottom line of these huge healthcare companies. So yeah, they want to take this to extort the American people in their position of vulnerability at a time when we're told planes may start falling from the sky, at a time when people's airplane tickets are being rendered valueless because a lot of these flights are not going to be able to be made, and all kinds of other problems are happening, while at the same time, our federal workforce is not being paid. These are not the right people to punish for the failures of Obamacare. Don't let them carry that burden. Don't make them do it. They didn't do this to the American people. Obamacare did. Let's fix Obamacare. Let's make it legal again to have health insurance, actual health insurance, not that sort of bastardized form of health insurance that emerged from Obamacare's endless regulations that result in diminished quality, lower coverage, and endlessly higher premiums. Mr. President, this shutdown has gone on long enough. This shutdown should come to an end, and it should come to an end by the very generous offer made by Republicans, time and time and time again, to continue at spending levels that until just months ago were the Democrats' own spending levels. It's not enough for them. We've got to end the madness and end the shutdown. At the very least, even if we're not to end the shutdown, we should pass Senator Johnson's bill. We should do that tonight. We should do it right now. Because regardless of what you think we ought to do with Obamacare or any other aspect of government, these workers who have now gone for some time without a paycheck, they should not be required to make this sacrifice, especially when you consider what it's for. Hiding the true cost of Obamacare, that is shameful. Again, I thank and I commend Senator Johnson and his team for putting together this legislation. I'm proud to support it. I wholeheartedly endorse it, and I plead with my colleagues to vote for it, and let's get these workers paid. They deserve nothing less. Thank you.
And I want to thank the Senator from Utah for his remarks.
Senator from Wisconsin.
Mr. President, I don't want to spend all the time refuting all the misrepresentations from the Senator from Michigan in terms of what phantom provisions he claims are in my bill. There's no slush fund. It is completely silent on presidential authority. I know some people want to reduce authority, but that's a bill that won't be signed. If you want to pay the federal workers, if you want to stop punishing them for our dysfunction, if you want to stop using them as pawns in this political game, that's a demand you have to drop. The money appropriated in this bill will go to pay workers. That also is a false argument. But if you're not quite satisfied with the language, it's been out there and we've been trying to work and get feedback for 2 weeks, and we've gotten excellent feedback from leadership, from discussions on both sides of the aisle, from OMB trying to perfect this thing. The solution is get on the bill. Get on the bill and offer amendment. Keep talking to us. Don't close it down. Now, We heard from a number of our Republican colleagues, we heard from Senator from Michigan, and obviously passions are running high. But there's a great deal of frustration, certainly on our side, when the other side simply won't take yes for an answer. But I came down here 2 weeks ago in as nonpartisan stance as I possibly could be. Because as Senator from Michigan stated, we all agree that these people ought to be paid. So the way to do that is not offer a bill on unanimous consent that has no chance of being signed into law. The way to do that is to vote to proceed tonight to this bill. If we could iron out differences, we could yield back time to get this thing passed. The Speaker of the House said he'll already come back and pass this. So we are so close. I realize they're going to be hard partisans. I know there are liberal unions that have now come out against this, but the bulk of the public sector unions are for it. They prefer my bill over anything else that they may also support it because this is permanent. This ends using federal workforce, and quite honestly, the American public as pawns in these partisan games for all time. Again, the American Federation of Government Employees, the Federal Managers Association, the Federal Law Enforcement Officers Association, National Air Traffic Controller Association. And again, I hope our Democrat colleagues listen to Senator Cruz's chilling and sobering remarks just a few minutes ago, the International Association of Firefighters and the Association of Flight Attendants. This bill has support because it makes so much sense. It is fair. So we had 3 Democrats join us 2 weeks ago. There are 2 other Democrats who have voted for the House CR. That brings us up to a total of 58. Now we vote against this because we didn't have furloughed workers. We've added furloughed workers. So hopefully those 2 will join us. I have talked to enough Democrat senators trying to get their input, trying to get this passed. I know there are Democrat senators that want to vote for this bill, that can vote for this bill. So, putting all partisanship aside, again, I want to appeal to your better angels. Search your conscience. Sign on to a bill. Vote for a bill that ends using federal workers, the American public, as pawns. The senator from Maryland said last week, let's not punish federal workers for our dysfunction. I think my closing argument has to be to go back to what the senator from Texas was talking about air traffic control in that situation. 500 safety issues reported recently in our skies. Search your conscience. Can you imagine? I mean, honestly, think about it. Imagine what the one Democrat staffer said, that we're going to cling to this until planes fall out of the sky. Think about how you would feel if, God forbid, a plane, another plane, fell out of the sky and people died. How could you live with yourself? Now again, you can continue the shutdown. I mean, that's your political choice. You can continue to vote against the very reasonable House continuing resolution. But you can still vote to pay federal workers. You can vote to make sure that air traffic controllers get back to their stations and keep our skies as safe as possible. You can vote to dramatically reduce the chance that a plane will fall out of the sky. We just need 2 more of you. Two more of our colleagues on the other side of the aisle who are working with, quite honestly, folks on this side trying to end the shutdown. Just 2 of those that I spoke to that I thought would vote for this. I'm begging you, 2 more. Let's get on this bill. Let's pay federal workers. Let's make our nation safer. Let's do the fair thing. Let's do the right thing. Let's vote to proceed to this bill and get it passed. With that, Mr. President, I yield the floor.
Mr. President,
Majority Whip,
Mr. President, I withdraw my motion to proceed.
Senator has that right. Motion is withdrawn.
Mr. President,
Majority Leader,
Mr. President, I move to proceed to the motion to reconsider the vote on cloture on the motion to proceed S 3012.
questions to the motion? All in favor say aye.
Aye.
All those opposed say no. The ayes appear to have it. The ayes do have it. Motion's agreed to.
Mr. President, I move to reconsider the vote on cloture on the motion to proceed S 3012.
Questions on the motion? All in favor say aye.
Aye.
All opposed say no. The ayes appear to have it. The ayes do have it. Motion's agreed to. The clerk will report the motion to invoke cloture.
Cloture motion. We, the undersigned senators, in accordance with the provisions of Rule 22 of the Standing Rules of the Senate, do hereby move to bring to a close debate on the motion to proceed to calendar number 191 as 3012, a bill to appropriate funds for pay and allowances of accepted federal employees for periods of work performed during a lapse in appropriations and for other purposes, signed by 17 senators.
Under the previous order, the mandatory quorum call under Rule 22 has been waived. The question is it the sense of the Senate that debate on the motion to proceed to S 3012 to appropriate funds for pay and allowances of accepted federal employees for periods of work performed during a lapse in appropriations and for other purposes shall be brought to a close upon reconsideration? The yeas and the nays are mandatory under the rule. The clerk will call the roll.
Ms. Also-Brooks, Ms. Baldwin, Mr. Banks, Mr. Barrasso. Mr. Bennett, Mrs. Blackburn, Mr. Blumenthal, Ms. Blunt Rochester, Mr. Booker, Mr. Bozeman, Mrs. Britt, Mr. Budd, Ms. Cantwell, Mrs. Capito, Mr. Cassidy, Ms. Collins, Mr. Coons, Mr. Cornyn, Ms. Cortez Masto, Mr. Cotton, Mr. Kramer, Mr. Crapo, Mr. Cruz, Mr. Curtis, Mr. Deans, Ms. Duckworth, Mr. Durbin, Ms. Ernst, Mr. Fetterman, Mrs. Fisher, Mr. Gallego, Mrs. Gillibrand, Mr. Graham, Mr. Grassley, Mr. Haggerty, Ms. Hassan, Mr. Hawley, Mr. Heinrich, Mr. Hickenlooper, Ms. Hirono, Mr. Hoven, Mr. Husted, Mrs. Hyde-Smith, Mr. Johnson, Mr. Justice, Mr. Kane, Mr. Kelly, Mr. Kennedy, Mr. Kim, Mr. King, Ms. Klobuchar, Mr. Langford, Mr. Lee, Mr. Lujan, Ms. Lummis, Mr. Markey, Mr. Marshall, Mr. McCormick, Mr. Merkley, Mrs. Moody, Mr. Moran, Mr. Marino, Mr. Mullen, Ms. Murkowski, Mr. Murphy, Mrs. Murray, Mr. Ossoff, Mr. Padilla, Mr. Paul, Mr. Peters, Mr. Reed, Mr. Ricketts, Mr. Risch, Ms. Rosen, Mr. Rounds, Mr. Sanders, Mr. Schatz, Mr. Schiff, Mr. Schmidt, Mr. Schumer, Mr. Scott of Florida, Mr. Scott of South Carolina, Mrs. Shaheen, Mr. Sheehy, Ms. Slotkin, Ms. Smith, Mr. Sullivan, Mr. Thune, Mr. Tillis, Mr. Tuberville, Mr. Van Hollen, Mr. Warner, Mr. Warnock, Ms. Warren, Mr. Welch, Mr. Whitehouse, Mr. Wicker, Mr. Wyden, Mr. Young. Senators voting in the affirmative: Barrasso, Blackburn, Bozeman, Britt, Budd, Cotton, Kramer, Cruz, Curtis, Deans, Ernst, Fisher, Graham, Grassley, Hawley, Husted, Johnson, Kennedy, Langford, Lee, Lummis, Marshall, McConnell, McCormick, Moody, Marino, Mullen, Ricketts, Risch, Schmidt, Scott of Florida, Sheehy, Sullivan, Thune, and Tillis. Senators voting in the negative: Bennett, Heinrich, Kane, Kim, Murphy, Murray, Padilla, Peters, Schatz, Schiff, Schumer, Van Hollen, Warner, and Welch. Ms. Slotkin, no. Ms. Murkowski, aye. Ms. Collins, aye. Mr. Banks, aye. Mrs. Hyde Smith, aye. Mr. Durbin, no. Mr. Justice, aye. Mr. Reed, no. Ms. Blunt Rochester, no. Ms. Cantwell, no. Mr. Warnock, aye. Mr. Scott of South Carolina, aye. Mr. Hickenlooper, no. Mr. Coons, no. Ms. Rosen, no. Crapo, Mr. Crapo, aye. Ms. Also Brooks, Ms. Also Brooks, no. Ms. Baldwin, no. Mrs. Capito, aye. Ms. Duckworth, no. Mr. Cassidy, aye. Ms. Warren, no. Ms. Hirono, no. Mr. Wyden, no. Mr. Young, aye. Ms. Hassan, no. Ms. Cortez Masto, no. Mr. Paul, aye. Mr. Sanders, no. Mr. Merkley, no. Mr. Wicker, aye. Mr. Whitehouse, no. Ms. Smith, no. Mr. Hoven, aye. Mr. Booker, no. Mr. Blumenthal, no. Mrs. Shaheen, no. Mr. King, no. Mr. Haggerty, aye. Mr. Rounds, aye. Mr. Gallego, no. Mr. Markey, no. Ms. Klobuchar, no. Mr. Ossoff, aye. Mrs. Gillibrand, no. Mr. Kelly, no. Mr. Lujan, aye.
On this vote, the yeas are 53, the nays are 43, 3/5 of the Senate duly chosen and sworn not having voted in the affirmative. The motion upon reconsideration is not agreed to. Majority Leader.
Madam President, I ask unanimous consent that the Senate be in a period of morning business with senators permitted to speak therein for up to 10 minutes each.
Without objection,
I understand there's a bill at the desk and I ask for its first reading.
clerk will read the title of the bill for the first time.
S 3166, a bill to rescind unused COVID funding and reduce the deficit.
Madam President, I now ask for a second reading, and in order to place a bill on the calendar of the provisions of Rule 14, I object to my own request.
The objection is heard. Bill will be read the second time on the next legislative day.
Madam President, I ask unanimous consent that when the Senate completes its business today, it stand adjourned until 12 noon on Saturday, November the 8th, that following the prayer and pledge, the general proceedings be approved today, the morning hour be deemed expired, the time for the two leaders be reserved for their use later in the day, and the Senate be in a period of morning business with senators permitted to speak therein for up to 10 minutes each.
Without objection.
Madam President, if there's no further business to come before the Senate, I ask that it stand adjourned under the previous order following remarks of Senator Cassidy.
Without objection. Senator from Louisiana.
Madam President, I'm going to try and present a way forward for Democrats, Republicans, and Americans out of our current situation with a different proposal than people have already thought of. Now, the government's been shut down for 38 days, and tomorrow we're going to vote again, and tomorrow the vote will again fail. But in Americans, Congress is frustrated. We need to open the government. So, if to open the government, we need to talk about health care, let's talk about health care. Let's have a conversation on the family. We have an affordability crisis, and health insurance is part of it. Now, this is personal to me. I'm a doctor, practiced in a hospital for the uninsured and the poorly insured for 20 years. And many of those people that came to see me were middle-income Americans who could not afford their medical bills and could not afford insurance. I want to see this solved. But if we're going to solve it now in this present circumstance, we need to move beyond entrenched ways of thinking that have settled us in our camps and refuse to allow us to listen to the other person. And I thank some of my Democratic colleagues for being here. We've got to be creative. Now, the Affordable Care Act, Obamacare, whatever you want to call it, tried to make health care affordable by giving insurance companies more money. The enhanced premium tax credits, EPTC is the latest example. It sends, next year it would send $26 billion to insurers, hoping that families see smaller bills. But that actually doesn't make health care less expensive. And for some, it actually makes the health insurance more expensive if you're not getting subsidized care on the exchange. So we can do better than just papering over the cost with subsidies. Instead of paying insurance companies to manage our money, let's trust Americans with a pre-funded, flexible savings account worth as much as the enhanced premium tax credit that they would receive. Let me repeat that. A pre-funded, not out of their salary, but pre-funded from the federal taxpayer, equivalent in value to the enhanced premium tax credit that they would receive. Now, let me make it clear. I'm not speaking for the Republican caucus. I'm not speaking for President Trump. I'm not even speaking as the Health Committee chairman. I'm speaking as a senator and as an American that sees us at an impasse and is trying to think differently about how we can move forward. So, I'm going to present to my fellow Americans an idea that hopefully will move us out of this stalemate and go forward. And I'm going to try and speak as if I'm speaking to the American back home. Here's the problem. Under the enhanced premium tax credit, if your insurance premium goes up, if the insurance company decides to pay more, they just get more subsidy from the taxpayer. Now, insurance companies get paid no matter what, and it doesn't matter how expensive the tab is. There's absolutely no incentive to bring the cost down. There's no transparency as to what the care really costs, and there is absolutely no reward for the family that goes to a place which is less expensive. It's like putting a Band-Aid on a broken bone. you're hiding the fracture, but you're not fixing the broken bone. Let's fix the broken bone, which is high healthcare costs. So, put simply, the enhanced premium tax credit does not empower patients. It enriches insurance companies. By the way, they're important. We need them. But if I have a choice of empowering you, the American, or enriching an insurance company, I and we should pick our fellow American. Now, imagine a different type of help. Not paying the insurance company another subsidy, but putting money pre-funded, not out of your salary, but roughly equal to the enhanced premium tax credit, put that into an account that you control. Every eligible American citizen on the exchange would receive this federally pre-funded flexible spending account. And it would work like the prepaid health account you use for real-world health expenses. It would actually have more flexibility than your current insurance proposal. You go to the dentist, it can pay for dental care. You go to the orthodontist, it can pay for your orthodontal care. It can pay for eyeglasses, which typically insurance does not pay for. Prescription drugs, medical supplies, your deductible, your copay, it can pay for it all. Now, it wouldn't pay for insurance premiums. This is about you spending directly for your healthcare costs, not about enriching insurance companies. It would pay for the care that families actually use. That's what a pre-funded flexible spending account actually does. I keep emphasizing pre, because I mention this to people, and they say, wait a second, this has to come out of my salary. No, this would be the money that would go to an enhanced premium tax credit, and instead, it goes into this account that you control. Now, it seems complicated for some. I go and I mention it to them, I say, oh boy, this is something different, Bill. This is a great idea, but it's kind of like, just too different. 72% of Americans getting their health care through some government entity are offered flexible savings accounts. 47% of people getting insurance through their employer are offered FSAs. This is something that is used by millions of Americans already. So what I'm proposing is just to give this option to people on the exchanges. And by the way, the federal government already offers flexible savings accounts to people on these small business exchanges. Members of Congress, we are on the Obamacare Small Business Exchange. We have the option of choosing an FSA. My family has one. And the Department of Treasury already has an office through which they funnel money to pay for these flexible spending accounts that I, as an individual, choose to get. So what we're speaking of is just offering to people on the exchanges, that on the individual exchange, that which is already offered to people on the small business exchange, and paying for it by the same mechanism in which it's already done through that exchange. Now, still, there's going to be some bureaucracy involved. But if there's any president that can overcome the inertia of the bureaucracy to make it happen by January 1, 2026, is Donald J. Trump. Donald Trump is the man who, when it was told it would take 18 years, 10 years, 18 months to come up with a vaccine and a program to prevent COVID transmission, he did it in 10 to 11 months. This president can overcome the inertia, and we have a running start because the federal government is already doing this. Now, let me make clear the key differences between enhanced premium tax credits and federally funded flexible spending accounts. First, who gets the money? Under the enhanced premium tax credit, insurance companies. Under this, it is patients and families. What can it be used for? Here, the premium tax credits go for insurance premiums. Period, stop, full stop, boom, it goes to the insurance company. Here, real care. Your doctor visit, your deductible, your copay, your dentist, your glasses, your prescriptions, that sort of thing. Who makes the decision? The insurance company. Just wait and fight with them about a pre-authorization. Under the flexible spending account, you make the decision. You have the power. And lastly, does it lower cost? No. It is pretty clear. If we continue to fund insurance companies no matter what they pay, it drives up the cost. In contrast, if you empower the patient, that mother is going to find the most affordable option. It's been studied. If you give people something that they perceive as their own money, they hunt for that bargain. By the way, if they go and they find out that the cash price is cheaper than what the insurance company would charge them, they will have the option of using this for the cash price. So we have reforms in here that give the patient even more power. Good thing about that, as the patient saves money, so does the taxpayer, and that's a good thing. So, the pre-funded, flexible spending account doesn't treat people like dependents of the government, as do the enhanced premium tax credits. It treats you like a capable consumer who knows what is best for your family. You decide where to go for dental work. You decide your pharmacy. You decide whether to pay the cash price or the negotiated price that the insurance company offers you. And instead of Washington paying insurance companies to manage your day-to-day care, you manage it with fairness, transparency, and flexibility. Now, some will ask, won't this cost money? Of course. In the first year, it'll be about the same amount as the enhanced premium tax credit. And my Democratic colleagues should like that. But the individual would be getting better value through the federally pre-funded FSA, because she is spending it on that which she actually needs, as opposed to up to 20% of it going for overhead, profit, and administrative cost. It isn't just fiscally responsible, it's common sense. Who wouldn't rather have their money in their own pocket than for the insurance company to dictate how they spend it? So here's the choice before us. In conclusion, we can keep paying insurance companies to paper over the higher cost behind confusing bills in a system which actually raises the cost for some, or we can give Americans the tools, we can trust our fellow Americans to pay for their care directly at fair prices with transparency. If you will, it puts patients first, not insurers. It encourages competition, it rewards smart choices, and it begins to make healthcare truly affordable, not by inflating subsidies, but by unleashing the power of the consumer. Let's stop writing blank checks to insurance companies. Let's invest in our fellow Americans. I say this, we have to first open the government. This takes writing some legislation. We have to open the government. But we have to be willing to take a risk to solve a problem and not be afraid to do something different. I have seen in our chamber right now a hunkering down. We've not been able to solve it, so we're not going to try anything different. We're just going to wear the other side down until they wave the white flag. Now is the time to be creative. I'm a rock rib Republican, but I will say what I just offered is not a Republican solution. It is not a Democratic solution. It is an American solution. Let's open the government. Let's work together. Let's fix healthcare by giving the American more power, not the insurance company. Thank you.
Senator
Your question?
Washington, without objection.
Thank you. Will my colleague yield for a question? Thank you. I noticed in your proposal, you're talking about something that you would hope to affect January of next year. Is that correct?
That is the goal, to have this ready for next year.
What is the senator from Louisiana's interpretation of how the market controls you're trying to create a market mechanism where you're giving the consumer the same amount of money you would give them in the tax credits to make the insurance more affordable only through a health savings account. But how do you know once you gave that in the health savings account, the market is going to not still have an increase above that amount? So how do you think this affects the market?
Wonderful question. First, this is a flexible savings account, not a health savings account. There is a legal distinction. I want to make that. When the enhanced premium tax credits are not renewed, we know the insurance companies have already set up their rates. And so the consumer, our fellow American, will be choosing from the offerings that have been made by the insurance company for them to choose from. The difference would be, and they will see, by the way, that the policy for someone at 400% of federal poverty level costs about $2,500 more a year than it otherwise would have with the enhanced premium tax credit. This would be supplemental. We would say to that individual, you're at 400% of federal poverty level, your policy is $2,500 more a year, you will get a flexible spending account pre-funded to help offset the cost of this. Now, if it's my family, I would say, I got $2,500. Maybe instead of going for a silver plan, I'll go for a bronze plan. Because now I can offset the higher deductible with my flexible savings account. And because I'm going for a bronze plan, my premium will be lower. But that's trusting the American people. We are plugging into the current insurance market. We're actually not changing at all how it functions.
We're deal for another question. I'm assuming that you think affordability is the key. I certainly think affordability is the key. Nobody wants to subsidize expensive health insurance. We want to create market mechanisms to drive down the cost of health insurance, not just spend money to buy expensive insurance, whether you buy it through the tax credit or buy it through a health savings account. We want to create those mechanisms. So again, all of this is going to take place in November and December, right now and December. So somehow you would make some calculation in January about what would go into a savings account, or you're thinking of a flat number?
That's a wonderful question. No, if somebody, the federal government knows, or put it this way, many states have calculated what would be the insurance rate with an enhanced premium tax credit, and what will the insurance rate be without the enhanced premium tax credit. It has been calculated for our fellow Americans what the value of an enhanced premium tax credit would be if they signed up for a certain policy in their state, given their age and their health condition. They know that. The question is whether they get the credit or not. Well, they're not going to get it, so the policy is going to be higher. And this, under the plan, if we can agree to it, they would then get the FSA in an amount equivalent to that which they did not receive as a payment to the insurance company. Instead, it would be a payment to the flexible savings account they would have, and that they would then use it for these services.
If the senator would continue to yield, the issue is that, so much of this is already set up, and I think you're trying to be creative in a way to, instead of the Alexander Murray cost revenue sharing, I think you're trying to figure out something that would get people the same amount of money to make them whole over the next year or two. Is that correct?
That is correct.
So I would say what we're trying to do is make people, as the market is out there, whole over the next year or two. That's exactly what we're trying to do. We're happy to debate how we make health insurance more affordable after that. That has been a goal of our side of the aisle for decades. We want to make it more affordable. Now, we all get to be measured about how successful we've been on that, but I think that we're going to continue to strive to make it more affordable, and really are proud that we drove down the uninsured rate with the Affordable Care Act, because we covered more people, thereby lowering costs because not having so much uncompensated care. So I'm glad to see somebody saying, let's talk and let's put a proposal out there. Happy to continue to have a dialogue about any idea that helps us move forward. But the issue is that so many Americans are in this moment right now making these decisions, and how you affect that for the next 2 years is the biggest question. And you and I know, if we said, okay, we're huddling tomorrow, or the finance committee is huddling tomorrow, then everybody would be up here trying to convince us not to do various things. So the question is, how can we protect the marketplace for the next year or two in the simplest way, and then get about us going back to business, talking to each other, trying to work out what are the best creative ideas for lowering health insurance costs. I don't know why we haven't done a PBM bill. I mean, my colleague Senator Grassley and I have a bill. I think you have a proposal. Other people have a proposal. We're letting PBMs get away with so much in the expense of prescription drugs. I don't know why we don't spend all our time driving down the cost of health insurance. So I'm happy to work creatively on ways to protect the market over the next 2 years, so that we can finally get to some creative discussion. So I thank the senator.
Thank you for the questions, and let me just respond very quickly. I think the beauty of what I'm proposing is it fits in very nicely
with the insurance markets as they currently are. It doesn't require anything to change between now and January the 1st. It is too late to change those plans and those rates. It is just too late. This does not require those rates to change. This would be something which could benefit our fellow Americans next year and could be implemented by then. Yes, the bureaucracy is going to have to work hard. President Trump can get them to work hard. You mentioned several other reforms. I am in total agreement. We should be working to get Democrats, Republicans, that's what we need to do to get something done, in order to come together for a set of proposals that will lower healthcare costs. And both as a member of the committee, we both serve on Senate Finance as well as the chairman of the Health Committee, it is my intent to do that. We've got to do that. But this can work this year for Americans who are going to be on the exchanges, and that's my hope. With that, I yield. Thank you.
Under the previous order, the Senate stands adjourned until 12 tomorrow, Saturday.
upon it.